Okay, so I think this is recording. So let's go share screen, reproductive. All right. So this will just be reproductive one. I'll divide it into two parts. Reproductive one for male, reproductive two for female. Okay, so this is just showing you a sperm cell, a spermatid, and a oocyte. So both of these are haploid right now, but then when they get together, that will be diploid. So make sure you know that. This just functions of the reproductive system. So it's generalized here. So the male's job is sperm production, transport of the sperm to the uterus. Female's job is oviproduction, fusion of the gametes. A gamete is just a sperm or an egg. And then when those are fused, then that's the development of the zygote. So that would be diploid at that point. So male reproductive. So let's just go over some pieces and parts. So this is a testis, T-E-S-T-I-S. That's singular. Testes, if it was E-S, that would be plural. These little tubes in here called seminiferous tubules, that's where the sperm's made. This structure up here, kind of on the superior posterior aspect of the testis, that's the epididymis. So it's a big coiled tube, also tubule. And that's basically just a storage. So the sperm are pretty much ready to go there. So it's just kind of a holding pen. Yeah, there may be, some defective ones that are broken down and degraded in this place. But mainly it's just a holding pen. And then here's your vas deferens. They're trying to call it the Ductus Deferens, but nobody ever does. Because everybody still uses that term vasectomy, whenever they cut the vas deferens, for birth control, basically. So either one, I'll take either one, Ductus deferens or vas deferens. Vas, V-A-S, a lot easier to spell. So this is what a seminiferous tubule looks like when it's cut across and it's on a microscope slide. So it's kind of important to understand that, say, this is just like a tube, and it's all coiled up. It's like a garden hose. It's all coiled up. And then if you cut across it to make a microscope slide, you're going to just get a bunch of circles or oblong circles. It depends on, how your cut is going across them. But you're going to see a lot of these. And so that's just part of that tubule, but it's headed towards you on this screen. So this is the lumen right here. So this is where the sperm is, developed right here. Okay. And I'm not going to ask you about mitosis or meiosis or meiosis or whatever. But just know when all is said and done that you end up and you have a haploid sperm. So you make a lot. So there's about 1 mile of seminiferous tubule in men. I don't know if that's 1 testis or 2. I assume it's 2. But if you stretched it all out end to end, it'd be about 1 mile long. That's a lot of surface area for making sperm. This allows men to produce about 500 million spermatid a day. Right? So that's a lot. Okay. So let's see. So here they are. They're almost fully functional sperm at this point, So some pieces and parts. This is called a sustentacular cell. I don't call them that. I call them a much easier name, nurse, N-U-R-S-E. So it's just easier to spell. They use those 2 terms interchangeably in this case. So the nurse cells are the sustentacular cells. They maintain the blood-testis barrier. So if you notice, outside of your seminiferous tubule, that's where the capillaries are in the blood, supply. So there's a barrier. And there's a reason for that, because you don't want your immune system building up antibodies to your own sperm. And so these help maintain it. We've run across barriers before. We talked about the blood-brain barrier and the blood-thymus barrier. In this case, it's the blood-testis barrier. Now, you also have some more cells outside here, and these are called interstitial cells. And we'll talk about those more after a while. But you can see them here. Those are interstitial cells, and they're outside the seminiferous tubule. Okay. All right. So this is just talking about sperm production. I'm not going to ask you about meiosis and all of that. Just know when all is said and done, the spermatozoa, they end up haploid. Okay. That's the main message here. Okay. So during the spermiogenesis, that's just the anatomical maturation of the sperm cells. So we're not going to go into all the stages or anything. Just know when all's said and done, it's haploid. There's the flagella. Notice you got a lot of little mitochondria, because you got to make those flagella have to do a lot of motion to propel that sperm forward through fluid. Okay. What else? Sustentacular cells in the seminiferous tubules we just talked about. Just make sure they maintain the blood-testis barrier. That's the main question I could ask. I could do a bonus. They do release a hormone known as inhibin. Just know that inhibin stops the production of FSH. Remember, that's one of those anterior pituitary hormones, follicle stimulating hormones. So that's going to cut down on sperm production. They were actually trying to make a contraceptive based on inhibin in the male, but I don't think it ever panned out. I never heard much more about it. So as far as hormones, FSH and LH, follicle stimulating hormone, and luteinizing hormone. I know everybody always correlates these as with in the female system. But no, males have these hormones too. They just have different jobs in the male. So just know that follicle stimulating hormone supports sperm production. Luteinizing hormone, that stimulates interstitial cells. Remember those little guys we were showing you a little bit ago? To release testosterone. Okay. So these two hormones do totally different things in the female. And we'll talk about that on reproductive part 2. But just know these are anterior pituitary hormones, and they do have a job to do in the male. Okay. So interstitial cells release the testosterone. Testosterone promotes the production of mature sperm. It helps maintain some accessory glands of the reproductive tract. We'll talk about those glands later. Testosterone also influences secondary sexual characteristics like facial hair growth, muscle mass, body fat distribution, things of that nature. Take-home message here is that FSH, LH, and testosterone promote sperm production. Inhibin inhibits sperm production. So that could be true, false, or whatever. Or I could do a little multiple choice, on those. All right. So that's just refreshing your memory. Here's the edge of the seminiferous tubule, right? Here's the nurse cells maintaining the blood-testis barrier. They can make inhibin, remember? These are the interstitial cells, right? They release testosterone when LH, comes down, tells them to, basically. And then here's some little capillaries, okay? So the male reproductive tract. So make sure you know the pieces and parts here. Make sure you know epididymis. Make sure you know seminiferous tubule. Since this is online now, I'm not gonna hit you with the testes and the straight tubules and the efferent ducts, but that's all these structures in here. Mainly, I just want you to know seminiferous tubule and epididymis and vas deferens off of this slide. Okay. Know where the sperm are made, where the sperm are stored, and then where's the pathway. And that's the pathway out. Okay. So the epididymis, that's the way you spell it. Make sure you spell it right. I keep wanting to put a US there, but it's an IS, right? So make sure you spell it right. Facilitates functional development of the sperm. It stores the sperm. The bad ones can get broken down and degraded there. The vas deferens, I don't call it ductus deferens. Sperm can actually be stored for months there. So if someone gets a vasectomy, right, there can be sperm on the other side of the cut. So that's why they have to keep checking at the doctor, because they could still be viable sperm in there. And so they have to keep checking to make sure that there's no sperm in the ejaculate, after a vasectomy. Urethra, we talked about that in the male before on test 1. It's part of the urinary system, but part of it is also considered reproductive because it's a pathway for sperm also. Where in the female, no, the urethra is totally separate. It's only part of the urinary system. You'll get that on the next lecture. All right, here's the glands I want you to know. They don't call these seminal vesicles anymore. They call them seminal glands. I'll show you what they look like in a minute. Prostate gland, probably everyone's heard of. And then this weird little name is a pair. There's 2 of these, and there's 2 of the seminal vesicles. There's only 1 prostate gland. The bulbourethral glands. It's just such an odd name that nobody seems to forget it on the test. So these glands produce secretions that make up the majority of the ejaculate, or the semen volume. The sympathetic, I don't stress on this too much, but the sympathetic nervous system controls the release or the ejaculation, and the parasympathetic controls the erection. Remember when we were going over sympathetic and parasympathetic neuro, I said don't worry about it in the reproductive part, because I didn't want to confuse you. We just did fight or flight for sympathetic, and we did rest and digest, for parasympathetic. But in the male, in the sympathetic nervous system controls the ejaculation, and the parasympathetic system controls the erection. So probably not going to ask it on this test. All right. So these secretions that we were talking about from these glands, first of all, let's look at the glands. Let's see if I'm going to probably have to go all the way to the back of this PowerPoint. Should have moved that slide. Too late now. There's the bladder. There we go. So this is the back of the bladder. We're looking at the posterior. Those are the seminal glands or the seminal vesicles, right? So they kind of look like rabbit ears on the back here. This is the prostate. Notice, and they cut a wedge out of it so you can see inside. Notice the way it's wrapped around the urethra. So that way, that could cause problems. Like an older male, a lot of times the prostate, it may not be cancer, but sometimes the prostate will just hypertrophy. It'll get larger, and that'll squeeze this urethra almost closed, and it makes it hard to go to the bathroom. So that's why you always see commercials for like Flomax and things like that on TV to make that easier to go to the bathroom. It's treatment for that. All right, so there's your bulbourethral glands. See the way you have 2? They're little, they don't do much. Maybe 5% of the volume. It's like a lubricant, basically, right? Most of the fluid for the ejaculate comes from the seminal vesicles. I forget the percentage. I think it's about 60%. And then the prostate does about 30%. So if somebody has to get their prostate out, say they have prostate cancer, they can still be fertile. There's still enough fluid to float the sperm, basically, because you still got these seminal vesicles, right? And that's what's making the majority. All right, so let's back up. Back up. Where were we? All right. So we're talking about these accessory glands, seminal glands, prostate gland, and bulbourethral glands. Let's take them one at a time. Seminal vesicles make about 60% of the volume. High levels of sugar to provide nutrients. slightly alkaline to neutralize secretions. The vagina could be an acidic environment. And then these secretions are released into the ejaculatory duct. I'll show you where that is in a little bit. Okay. Prostate gland makes up about 30% of the semen volume. It's a milky solution that contains several enzymes. This could be a bonus. Seminal plasmin is secreted. It acts almost like an antibiotic. So the prostate gland makes it. So that cuts down on infections, right? Bladder infections for the male. So males are less prone to bladder or urinary tract, bladder infections because, and urinary tract infections in general, because of the seminal plasmin. And I think it's like a little antimicrobial peptide that cuts down on infections. Also, the urethra itself is just longer in the male than it is in the female. So it's much more difficult for bacteria to get from outside all the way up to the bladder. Okay, so you got these two things in a male protecting them from urinary tract infections. Now, can they still get a bladder infection? Yeah, it's possible. They're just not quite as prone to it as female. Most of those infections, by the way, when you take micro, are E. coli. So secretions are released into the urethra. We talked about that. Bulbourethral, about 5% of the semen volume. It's clear alkaline mucus. It's a pH buffer. Lubricates the Glans penis. We'll talk about the structure in a little bit. And the secretions are released into the urethra. I'm not going to do we spell straight wrong, straight pubile. I'm not going to talk about the pathway. We're not going to do a tracing, but some of those structures we need to know. Maybe I could ask a question. So descent of the testes. So when you're a fetus, when a male is a fetus, the testes originate way up high in the abdominal pelvic cavity near the kidney. So look at this slide here. See how high up it is? It's a fetus, right? And then as they're developing, this little structure here, put a box around it, gubernaculum testis, that somehow pulls these guys down. So here's the scrotum. That's going to be the skin around the little cavity down here that the testes are going to be in, right? And it's going to pull them, and then you're going to end up with an inguinal canal here, right? And then at birth or shortly thereafter, the testes should descend into this scrotum, right? Now, if they stay up there, that could be a problem, right? So that's called cryptorchid. Cryptorchid, I think, or you could just say undescended testes. So that has to be fixed. They can do it surgically, or if it stays in there too long, or sometimes they'll just remove that one because you can't leave it in there. First of all, it's going to be non-functional. Second of all, it could cystify and it can actually become cancerous. So usually they just do a surgery and bring it down. I don't know when they do that surgery and how long they have for that to happen. Yeah, you'll have to look that up. I don't remember. So pieces and parts, just remember the gubernaculum testes, remember the scrotum here, and remember the inguinal canal. So that makes males more prone to an inguinal hernia than females. Okay. So let's back up a little bit. So there we go. All right, talked about all that. Talked about the descent of the testes. So what we did not talk about, so that brings down the connected vessels, we spelled nerves wrong, vessels, nerves, and ductus deferens, all that comes with it. But also muscle from remember your internal obliques? Some of that gets drugged down with the testes, and that becomes cremaster muscle that will raise and lower the testes for temperature control. So notice the way the testes are outside the body, the abdominal pelvic cavity now. So it's cooler out here. I don't know, maybe 1.1 degrees C on the average. So the sperm develop better at a little bit lower temperature. So that's why that is. So, and the muscle that gets drugged down here with this spermatic cord and the testes that can raise the testes if it's cold to get it closer to the body warmth, or relax and let them be lower to get it further away from the body if the temperature is too high. So if a couple are having trouble conceiving, that's one of the first questions the doctor's going to ask. Boxers or briefs? They just want to know, is it a temperature thing, right? So that's the easiest thing to fix, right? So if it's just a temperature thing that's causing the sperm to be non-viable, a lot of times they can figure that. So the cremaster muscle we talked about, and then the tunica vaginalis, I'll show you where that is on another picture. That's the serous membrane, that peritoneal membrane that gets drugged down with it. So that's watery fluid is produced there, and it just kind of helps things move around. So it's kind of like lubrication. So we did that. So now let's go all the way to the back again and look at these pictures. All right. So here's a sagittal section. You can see the prostate. And now you can see the ejaculatory duct. See the way it's cutting through a little at a diagonal there? Okay. And there you can see one of your seminal glands, right? And you can see one of your bulbourethral glands. Okay. Let's look at the urethra. That's the urethra, right? So it's divided into three parts. I could ask this, if I put a bracket here, that would be the prostatic urethra. If I put it right here, that would be the membranous urethra, not very much to that. And then all the rest of it, you can call the penile urethra, or you can call it the spongy urethra. I don't care. Okay. So down here, that would be the glans penis, G-L-A-N-S. Don't put a D on the end of it, G-L-A-N-S. And then the skin outside of here in an uncircumcised male, the foreskin, that's called the prepuce. It's on another slide, P-R-E-P-U-C-E. But if you called it foreskin, I would give you credit for that. But in a circumcision, they take most of that away. All right. So don't forget your epididymis. Don't forget your testes, right? Now, there's your vas deferens. See the way it loops around? Yep. Okay. So point and name. All that's point and name. This, so they get into the spermatic cord. So see the cremaster muscle, the cremasteric muscle. I guess they just call it cremaster now. That can raise and lower the testes, right? Inside, so if you cut open, you can see the arteries and veins, right? And you can see the vas deferens. So all of that's called the spermatic cord right here, okay? Now, what happens if a testicle gets twisted? Can that happen? Yes. It's called a torsion, T-O-R-S-I-O-N. That's an emergency situation because it can cut the blood flow off to it. So that has to be fixed right away. Sometimes the doctor can just manually manipulate it back into place without doing a surgery, but sometimes they have to do a surgery and go in there and fix it pretty quick, right? It's very painful. They usually know it's happened when it's happened, okay? We'll talk about that when we get to ovaries too. It's possible to get an ovarian torsion. It's much more rare. It's not as common, but it can happen. T-O-R-S-I-O-N. Okay, so this, you can see the cremaster muscle. The outside covering of the testes is the tunica albuginea. It just means white tunic. And that's your tunica vaginalis. So I don't know why they named it this in the male. It's also named that around the ovary also, I think. But that's just that serous membrane that got drugged down, right? So it's lubricated in here, so this can kind of twist and move around, okay? There's your seminiferous tubules. There's part of your epididymis, okay? So, and there goes your tunica albuginea across here, all right? We showed that view already. And then this is a penis cut across like this. And so now you can see the erectile tissue. So this is corpora cavernosa, and this is corpus spongiosum. Sorry. Scratch that. Both of these are corpora cavernosa, corpora cavernosa, and down here, I just had my little pointer wasn't moving. So, and then this is the corpus spongiosum, okay, around the urethra. So corpora, that's plural, corpora cavernosa are these guys. And then this is the corpus spongiosum here. So that's all erectile tissue. And you notice, see the little arteries, that's fed by blood. And that's why Viagra works, by the way. It increases the blood flow. It was originally developed as a heart drug, trying to dilate the coronary arteries. And so anyway, it increases the blood flow here. So that's why if a man is having erectile dysfunction, they need to get everything checked out, because they could have arterial disease. So if your arteries are clogging up here, they may be clogging up in your heart also. So you can't just hand out Viagra without doing a checkup, you see. There's the way you spell prepuce, P-R-E-P-U-C-E. There's the Glans Penis, right? It's just a weird little view, but you can see the bulba urethral, you can see part of the prostate, and even behind there, you can see this a little bit of the seminal glands there. You can see the vas deferens. So, all right, that's just a different view there. Okay. That's just a meatus, external urethral meatus, the opening. There's the glands. All right, there's the scrotum. So just make sure you know all the pieces and parts that we went over, and we'll do female next time. All right, let's see, did we forget anything? Did all the glands. We did the view here where you can see the seminal, where you see the seminiferous tubules, and you can see the epididymis, you can see the tunica vaginalis and the cremaster muscle and the tunica albuginea. This is all tunica albuginea basically right here. Right. I'm not going to ask read testes on this test, so you can scratch that out. Okay. Then we did spermatic cord, and we talked about, there it is, 1.1 degrees C below body temperature. Not all animals are like that. Next time you go to the zoo, go look at the elephants. The elephants, you'll notice there's no testes hanging down. That's because they're inside. I don't know why. Maybe it's cooler in there than where they're from or whatever. But actually, theirs are inside. If you watch Animal Planet, they talk about that. Okay. All right. I think we're done. So I'm going to go stop share. And we're going to go in and end meeting. And then I'll record the other one tomorrow. This one should be up tonight. Okay.